Welcome to the Health Matters on the Medicine Box. I'm your host, Ekta Batra. Previously, we explored childcare on a broader scale, but today we're zooming in on a topic that strikes at the very heart of parenthood, baby care. Imagine this, every year 26 million tiny miracles are born in India. These precious souls, aged 0 to 6, make up 13% of our nation's population. Baby care in India is nothing short of a rich, vibrant tapestry interwoven with the threads of ancient traditions and the latest medical advancements. Our goal then is to provide holistic care that nurtures the physical, emotional and social development of every child. But the path to nurturing these young lives is fraught with challenges. Prematurity, low birth weight and a host of infectious and non-communicable diseases plague our smallest citizens, especially in rural areas and amongst socio-economically disadvantaged families. These families often lack access to adequate healthcare, sanitation and nutrition. Urbanization, though a beacon of progress, brings its own set of hurdles. In cities, while healthcare and education are more accessible, infants face unique challenges, persistent coughs and colds, infectious diseases, parents facing stress from high-pressure jobs, and lastly, a rapidly evolving tech and entertainment landscape for children. All of this takes their toll. But fear not, for today we have a guiding light in our studio. We are honoured to welcome Dr Mahesh Balsekar, a leading expert in paediatric care and author of the paediatric book on childcare, 0 to 2, Baby and You. He will shed light on essential topics ranging from nutrition to sleep patterns and safety for our littlest ones. Welcome to the show.
Although the biochemical composition of formulas is getting closer to breast milk, there is simply no doubt that breast milk is a superior option when it is possible. So over the first several weeks, the baby might be on a fruit for breakfast, a khichdi for lunch, and a soup for dinner. In infants, as you know, we don't use cough-cold medicines. If there's fever, you'll give some paracetamol. If the nose is blocked, you'll put some saline drops. But we avoid medications till the age of at least 3. Under the age of 18 months, there should be no screen except FaceTime with family members. Between 18 to 24 months, screen time is best avoided. If you do screen time, it should be educational.
Well, let's start with when the baby is born. One of the key topics is breastfeeding. Let's start with that. For example, if you could just shed light on how long should a baby exclusively be breastfed?
The WHO and all professional committees have recommended that the baby should be exclusively breastfed for at least 6 months. Solid foods are normally started after 6 months, and breastfeeding continues for a year and according to WHO up to 2 years. If breast milk is insufficient at any time, then formula or fresh milk can be started earlier.
Okay. Is formula feeding as beneficial as breastfeeding for babies when you don't have a choice?
When you don't have a choice, most of the formulas are now made to with a composition very similar to breast milk. So all the extras which are required have now been identified and they put. For example, the omega, the DHA, the fatty acids, the vitamins, the iron and everything. But breast milk is essentially a live substance. There's antibodies, there's cells and there's immunity. So although the biochemical composition of formulas is getting closer to breast milk, there is simply no doubt that breast milk is a superior option when it is possible.
Okay. All right. Now coming to solid foods and weaning of breast milk, when should one probably start introducing solid foods to the baby?
So solid foods are typically started at 6 months. A baby does extremely well and perfectly well till 6 months of age. So solid foods, what are called complementary feeds, are started at 6 months. If the baby is not doing well, not gaining weight, has reflux, is vomiting a lot, you may start a little earlier, maybe at 5.5 or 5 months or occasionally earlier. But the thumb rule is baby should be exclusively breastfed till 6 months and solids after that.
Okay. What are the best first foods from an Indian context to feed the baby?
So there are a lot of cultural differences and there's no one way to go about it. Many believe that you shouldn't start with fruit because it's sweet and then they don't take other foods. So you may start with vegetables, for example, all the pulpy vegetables, the carrot, pumpkin, sweet potato. Later the second feed can be a rice moong dal khichdi, and subsequently you can start with some mashed fruit like stewed apple or banana milk. So over the first several weeks, the baby might be on a fruit for breakfast, a khichdi for lunch, and a soup for dinner.
Okay, all right. So that's on the food part of it. When does one introduce salt and sugar into the diet?
So a baby's kidneys are immature. So it is not advisable to start salt till 9 months. If you start at 9 months, it should be restricted. And after 1 year, a child can eat table food or family food. Sugar is something which we should all be restricting. And sometimes what happens is that when a baby is exposed to sweet foods in early childhood, you develop a craving and a desire for sweet food. So you're creating habits. So it's best to avoid sugar. And if you need to sweeten, it's best to use natural sugars like figs or dates or prune juice. And that may be one good way to sweeten foods which you need to.
And that can be introduced at 6 months as well?
Generally at 8-9 months.
Okay, all right. Now coming to health and hygiene, what are the best practices for maintaining a baby's hygiene?
So for babies, I think what most parents do naturally works. And I think skincare is important. For young children, a lot of parents use sanitizers before you touch infants, and I don't think that's necessary. Maybe in the hospital in the first few days, or if the baby is vulnerable, yes, but after that it should be normal. We should remember that our body is full of bacteria. This is called the microbiome. So it is impossible to eradicate bacteria from the environment. But of course, general hygiene is important. For older children, I think the most important thing is water care, oral care. Genital care is important. In girls, for example, parents should be told that cleaning should be front to back and to lower the incidence of urinary tract infections. And boys should be told and taught how to clean themselves. So this is important. In older children, again, hand washing is very important. This is something which has to be taught. And respiratory hygiene. I think with COVID, everybody is aware that when you cough, you have to cough in your elbow. If you do it in your hands, you're going to touch everybody else and it's going to spread. So hygiene is something which children need to be taught.
How can one prevent common illnesses in babies, say such as colds and stomach infections?
A child is born with a low immunity. And it's only with exposure to normal viruses that they actually gain immunity. So it's quite common that the first year a baby is at home and protected and they don't get too many infections. Once they start going to play school and nurseries with 30, 40 children there, they are going to get infections. This is normal, expected, and there is no way you can prevent it. So parents need to understand that getting 4 to 6 viral infections a year is normal and common.
But then how do you deal with those 4 to 6 viral infections? Do you just wait it out, or you eventually have to use antibiotics?
So most of these are viral infections and you have to wait it out. So in infants, as you know, we don't use cough cold medicines. If there's fever, you'll give some paracetamol. If the nose is blocked, you'll put some saline drops. But we avoid medications till the age of at least 3. And most of them run their course. If it's severe, prolonged, there's a recurrence in symptoms, signs of secondary infection, then yes. But most of these children recover by themselves.
Okay, all right. Well, now let's get to sleep patterns. What is a typical sleep schedule for a newborn which you would recommend, and what do you see in India generally as sleep patterns?
This is a very hot topic right now. And I think the entire world is sleep deprived, and so are children. So I think it's nice to know that babies need a certain amount of sleep. So in the newborn period, for example, they sleep for 16 to 20 hours. Between 3 months to 12 months, they need about 12 to 15 hours of sleep. Now there are tables within books and which I often give to parents. So for example, initially they have about 3 naps a day. Around 9 to 12 months it becomes 2. At 15 months it becomes 1. And they usually drop the afternoon nap at 3 to 3.5 years of age. So that is the total duration of sleep, and this is the way the naps progress.
Okay, but how can you probably help, or what do you recommend for a baby to sleep through the night?
So there are a lot of cultural differences here. So in the Western world, when they are working, when they don't have help at home, it's mandatory that you sleep trained, because if the child doesn't sleep, it's not possible for the family to function. And they've been implementing sleep training for many years. And this generally starts at the age of 5 to 6 months. And this means that what happens at 5-6 months is that sleep cycles develop. So when sleep cycles develop, they don't fall asleep, remain asleep and wake up. They are in deep sleep, light sleep, and this typically alternates every 90 to 120 minutes. So when they are awake at that stage, if the mother is available, rocks, feeds, comforts, then the baby learns to expect that behavior. So these are called sleep associations or sleep rituals. So this is the time the mother has the option of nudging the baby to sleep better. So there are many sleep training methods which are normally started at 6 months. There are gentle methods which are acceptable, and there are some harsh methods, particularly in our environment, they're not acceptable. But I think every parent should try to get the baby into a good sleep routine. It's good for the baby and it's good for the mother.
Okay. What would you recommend is probably the most gentle way of doing that? Because there's a lot of controversy, like you mentioned, when it comes to sleep training.
I think the pick-up, put-down method is the most practical. It normally starts at 6 months. What this means is that if the baby wakes up at night, when the baby is in the light sleep phase, you pick up the baby when the baby is agitated. The moment the baby is quiet, you put the baby down again. So the baby's memory of going back to sleep is not with breastfeeding and not in your arms rocking, but in the baby's own bed. And then you let the baby cry for increasing durations of time. So the baby learns to what you call self-soothe and put herself or himself back to sleep.
Okay.
This generally works well.
What are your thoughts on co-sleeping?
Again, there is a very cultural difference. And the problem in India is that we read Western books and we want Western results, but we want Indian methods, and that doesn't work. So co-sleeping has been shunned in the Western world, mainly because of its association with SIDS. Fortunately, SIDS in our country is relatively low, but it exists. So it's very important that the baby should not be lying next to the mother, where the mother can roll over, or the blanket can go on top of the baby, or the pillow can come into the baby's face. So if the mother chooses to co-sleep, these precautions have to be taken. It's called safe co-sleeping. That means the baby should be at a distance, maybe at an arm's length, but there should not be any loose things lying around so the baby sleep. In general, medically, we encourage a separate cot. That's always safer, but can be within the arm's length so that the mother can reassure the baby. So this becomes like a best of worlds situation.
What is your recommendation on these kind of traditional practices?
So there are many traditional practices, and in general, I go along unless they are harmful. I think we don't need to be modern. We don't need to be Western just for the sake of it. So for example, there is a habit of an oil massage. I see no reason why we should be opposing it. But if you tell someone that you want to put oil in the nose and ears to clean it, that would be a no. If the baby has a reaction to the oil, of course you're going to stop it. So this is, for example, Kajal, there have been cases of lead poisoning because some of the commercial preparations had lead. So one would generally avoid that. You can also injure the eye and cause infection. So you have to individualize it and see what is safe, and then you continue. Otherwise, no.
Oh. Okay, which would be a no-no, which you would, probably tell new mothers not to adopt?
So a common practice is to squeeze both a baby boy and a baby girl's breast tissue, saying you're removing the milk. Because of the placental hormones, babies, both boys and girls, develop a breast nodule. And if you start squeezing it, this leads to breast infection. This is very important. Putting oil in the nose is really harmful because they can aspirate it and you can get what is called lipoid pneumonia. Similarly, we generally prefer oil for skin care. Chana basin and all that often cause allergies, and it's not true that they remove body hair or anything like that. Body hair is again because of placental hormones, which normally goes between 6 and 9 months.
Okay, all right. In terms of milestones, what are the key developmental milestones that one should be aware of?
This is a very important question because parents should be empowered and should know what normal milestones is. And it's also joyful to see the child develop. So if you have a sort of a roadmap as to what the baby is going to be doing, then parents follow it. So most pediatricians have a chart which tells parents what babies achieve at different ages. So the milestones are divided into gross motor, fine motor, social, language, and cognitive. There are charts available, difficult to discuss everything. So for example, head control is normally 3 to 4 months. Rolling over is 4 to 6 months. Sitting is at between 6 to 8 months. Crawling is at 9 months. Walking is 12 to 14 months. But we have to also look at speech. This is extremely important. So most babies will start socially responding as early as 6 weeks. This is called a social smile. Then they start cooing and responding. By 9 months, they start responding to their name. By 12 months, they should speak 2-3 words. By 18 months, 6 to 8 words. They should look at you, have good eye contact, point, show. If you point somewhere, the baby should look there and socially engage with you. And by 2 years, they are forming sentences. So looking at the physical milestones is one thing, but looking at the emotional and social and speech is equally important.
Okay. Well, you know, before we get to a break, I just wanted to quickly ask you about safety purposes. Is it harmful to expose babies to screens? If so, by when can they be exposed and to what extent?
So screens again is a very hot topic, as you know. But the very fact that everybody is addicted to screen means obviously there are some advantages. Babies can learn, they can learn education, social skills, communicate with family members. So these are the good points. But the excess screen time, as we know, is extremely harmful. So under the age of 18 months, there should be no screen except FaceTime with family members. Between 18 to 24 months, screen time is best avoided. If you do screen time, it should be educational. And it should be educational with the parent sitting with the child and engaging. The screen is not supposed to be a babysitter, that the parents are busy elsewhere and the child is with the screen. Because a young mind is not able to absorb the contents. Things move too fast and sometimes they get glued, they are glazed and they are just quite paralyzed looking at the screen, but they are not absorbing. But if you use the screen as a tool, then it's okay. So 18 to 24 months you may do it, you don't have to do it because using books and other things is even better. After 2 years, the guidelines are Indian and American both, that it should not be more than 1 hour of screen time. But that 1 hour you should also look at the content. Content is as important as the duration. So it should be maximum of 1 hour, lesser the better. So screen is something which is part of our lives and it's our duty to see that children learn to use it productively and we should regulate it.
Okay, all right. Well, Dr. Balsekar, we have a lot of queries which have come in from a lot of mothers who have questions for you. We're going to take a short break and be back with all of them. Stay tuned. Welcome back. Well, we are discussing baby care with Dr. Balsekar. Dr. Balsekar, we have a whole host of questions coming in our rapid fire segment. Let's start with the first one where it's on gender roles and parenting. Should boys and girls be raised differently when it comes to play, expectations, responsibilities?
So this is important because often parents come and a baby is born and the mother says that I'm just waiting to dress up my baby girl. So these are stereotypes and beliefs which we project onto the baby. So I think it's very important that a child achieves her or his full potential. There are biological differences and they are to be encouraged and they are to be appreciated, but we should not limit it. So I think what it means is that we should not have standard stereotypes which children follow, and we have to give them roots and we have to give them wings so that they can follow their own patterns.
Okay. Does having a stay-at-home parent significantly benefit a child's development, or can daycare working parents provide the benefits as well?
So the first 1,000 days, that's 3 years, are very important because the brain is getting wired. And the type of input a child gets, intellectually, emotionally, socially, all these connections are being formed. So it's not important whether the mother's working or not working, but it's important that both working and not working mothers should create a nurturing environment for the baby's brain to grow in a productive manner.
Okay. One of the mothers has asked that, can I keep my baby up late because my husband comes home late, he wants to spend time with the child. What can I do about that?
So babies thrive with a routine, and generally babies need to follow a structured pattern. Now, if it's going to be an occasional event where the father wakes up the baby or plays, that's okay. But as a general rule, I think the father should try to change his lifestyle a bit also.
Okay. When can I introduce chocolates, sweets?
So these are called discretionary foods. Sugar, as we discussed, should be avoided and delayed as much as possible. But generally for older children, this is started for weekends and occasional foods.
Okay, and by what age?
Generally after 2.
Okay. Kids are falling sick with coughs, runny noses too frequently. Is there anything that mothers can do to prevent that, and a solution possibly for the perpetual colds that they suffer from?
So a lot of the respiratory problems that we see is because of infections once they start school. So like we discussed, 4 to 6 viral coughs and colds is common. But these days, because of pollution and dust and other problems, the number of respiratory problems has gone up a lot. So it's very difficult to solve the environmental problem, but school infections are part of growing up. You can't prevent it.
Do kids need multivitamin supplements?
A child who is growing properly, eating a balanced diet, and seems to be fine may not need it. Giving a routine multivitamin is not harmful, but not essential. If the child was a little underweight or a picky eater, then I would give it, but not otherwise.
Okay, all right. Acid reflux in kids, it's becoming a more prominent problem. What are the symptoms? Why do kids get it? How do you prevent it?
So reflux is normal in young infants. So every baby spits up, and this is normal. We call it reflux disease, or GERD, gastroesophageal reflux disease, only if symptoms are severe. So if a child has projectile, large, forceful vomits, because of the acid coming up, the child is cranky, wants to be upright all the time, is getting choking or coughing spells. If the baby is getting nighttime coughs and wheezing because of reflux, then it needs treatment. The treatment involves a smaller, more frequent feeds in older children, avoiding tea, coffee, cocoa, and cola drinks, avoiding constipation, drinking enough water, keeping a time between bedtime and dinner so that you don't reflux at night. And in severe cases, you might need to medicate.
Okay, all right. Are oats healthy?
Oats are certainly healthy. So oats and nachni and the cereal other than rice and wheat are actually very healthy and should be included and part of a child's diet.
Okay. Should we take the general height and weight as a rule, or does each kid or child grow differently?
So the height is basically genetic, and there are formulas. So for example, if you have the mother and father, you add it and you minus or add 5 inches, and that gives you the average height. So this is called the target height. And the weight, it goes according to the height, and that's also constitutional. We are more interested that the baby is following the line rather than seeing whether the baby is on the top of the line or at the bottom of the line.
Okay. Does nutrition contribute to the overall attentiveness of the child and focus as well?
So many babies are emotionally disturbed when they are hungry or tired or sleepy. So keeping a child well-nourished periodically is important. There was a lot of talk of sugar causing hyperactivity. This is not true. That doesn't mean we should have sugar, but there is no link between sugar and hyperactivity.
Okay, all right. And lastly, should we turn to medicines? Should we turn to Ayurveda, homeopathy, and not just allopathy when it comes to, medicating?
So the system of medicine which you choose is often a preference of the family. What I would say is that for acute illnesses, one has to be a little careful in children, because infections and other problems can be acute and they can progress fast. But for recurrent and chronic problems, I think it's perfectly okay if you choose alternative systems of medicine.
Okay, all right, Dr. Balsekar, it's been a pleasure. Thank you very much for joining in and speaking to us on a whole host of issues within baby care as well as other questions as well.
Thank you.
very
Pleasure.
much.